Good evening and good morning, everyone. Thanks for joining this webinar. I'm delighted to be here and to be the person who's going to introduce our moderator and our speaker. So today's webinar is COVID-19 and mental health in the Asia Pacific: challenges, risks, and opportunities. This is the 5th webinar series that's hosted by the Association of Pacific Rim Universities Global Health Program in conjunction with the USC Institute on Inequalities in Global Health. And I'm delighted to have people joining us from all over the world, including Japan, Philippines, Russia, New Zealand, Malaysia, China, Hong Kong, Australia, so many places. So thank you. And shout out to my friends and students and families. So let me just tell you for a couple of moments about the APRU Global Health Program. I know some of you have been joining us every week, so please bear with me for a second. The APRU is a nonprofit network of more than 50 leading research universities in the Asia Pacific region. It is more than 20 years old. The Secretariat is based in Hong Kong. And the Global Health Program is one of several programs that is run by the APRU. So the Global Health Program is housed at USC. I am the director of the program, and it's been around since more than 10 years already. So I wanted to tell you a couple of things about the program. So this webinar series, this is the 5th of 8 webinars. So I hope you'll continue to join us every week. And we'll talk more about what's coming up next at the end of this webinar. We do have certificates of participation. When you registered, you were asked if you needed one for continuing education credits. So we will be sending those out automatically if you check that box within about a week. We have very limited manpower, person power here. I also wanted to tell you about a couple of other things. We have a special edition of a journal on migration. If you're interested and you do that work, please visit our website. We're accepting journal submissions until November 30th. So plenty of time. Those are being published on a rolling basis. We also have a conference coming up. This year, our conference will be held virtually. It is hosted by Fudan University, and they're organizing a fantastic lineup of speakers for you over 3 days, 2.5 hours per day. The dates are October 19th, 20th, and 21st. So again, I would encourage you to visit our website if you're interested. And we do have a student poster contest as part of that. Then the final thing that I want to talk to you about is the working groups. So we have a number of working groups, and we have one on mental health. And so tonight's moderator is the chair of our mental health group. We have 5 working groups, and if you're interested in participating in those, they do a lot of research projects, write papers, organize sessions for our conferences, etc. So now, without further ado, let me go ahead and introduce you to tonight's moderator. I'm very delighted that we have Dr. Maosheng Ran, who is Associate Professor in the Department of Social Work and Social Administration and the Faculty of Social Sciences at the University of Hong Kong. He has incredible expertise in mental health. He has medical degrees from West China University of Medical Sciences, a PhD in mental health from HKU. He has worked as an associate professor at Sichuan University, full professor at University of Guam, and he has a very long list of accomplishments which are available on the website. So his major research interests include social development and mental health, transcultural psychiatry, community mental health, psychosocial intervention, stigma, psychiatric epidemiology, disaster events and mental health, and suicide. He's received numerous grants from WHO, NIH, NIMH, and etc. So please look him up on the website. He has also posted a couple of papers if you're interested in taking a look at those. So we'll put the more information about that on the chat box. Tonight you can ask, as usual, questions and answers in the Q&A box, and I would encourage you to do that. Take advantage of the expertise of our moderator and of our speaker, whom I'm delighted to say is an expert from the University of British Columbia and is the director of the APEC Digital Hub for mental health. So I'm really delighted that she is able to join us this evening. So I will stop talking and I will have Dr. Ram take it over. Thank you.
Hello. Good evening and good morning. Yeah. First, I want to thank for Melissa's introduction. Yeah. It's my pleasure to be moderated today. So now I want to just use time to introduce something. Yeah. First, I want to say, as Melissa mentioned, this is the 5th webinar of the series of topic. Yeah. Today's topic is on the COVID-19 and mental health. Yeah, in the Asia Pacific. Challenges, risk, and opportunity by Dr. Jill Murphy, yeah, from the University of British Columbia. At the same time, I want to remind that during her presentation, and you can use the Q&A box to just ask your question. And you can send your question, yeah, using this. And I welcome all the participants. And so now it's my pleasure to introduce the presenter, the speaker, yeah, Dr. Jill Murphy. Yeah, Dr. Jill Murphy is a research associate in the Department of Psychiatry at the University of British Columbia in Vancouver and Canada, and is a strategic initiative director for the APEC Digital Hub for mental health. Her expertise is in global mental health in the Asia Pacific, with a focus on the implementation and scale up of community-based depression care. Dr. Murphy's research focused broadly on addressing a critical gap in care of people living with mental illness, particularly in low and middle income countries, predominantly through the adaptation and scale up of evidence-based practice. Her areas of interest include the integration of mental health services into primary care and community-based setting, the use of digital technology to improve mental health care, access and equity, workplace mental health, and enhancing meaningful stakeholder engagement in global mental health. She is currently a co-investigator on studies in China and Vietnam. So she has done a lot of work. So now it's my pleasure to give the time to Dr. Murphy. Please, Dr. Murphy.
Hi, everyone. Can you hear me okay? I'm going to try sharing my screen. Just give me 1 second. Great. So thanks very much, everyone, for joining this evening. I really want to thank Dr. Withers and the team at the APEC PRU for inviting me to be here this evening, as well as Dr. Rand for moderating this discussion. And so, as mentioned, my presentation is called COVID-19 and Mental Health in the Asia Pacific, Challenges, Risks, and Opportunities. And before I begin, I just want to acknowledge that the University of British Columbia is located on the traditional, ancestral, and unceded territory of the Musqueam people. Oh, I'm having trouble. Oh, that works. Sorry about that. And so before I get started talking about some of the issues around COVID-19 and mental health, I would like to introduce the APEC Digital Hub for Mental Health. For those of you who are not aware of it or who would like to learn more about it. And so as Dr. Withers and Dr. Rand mentioned, I'm the Director of Strategic Initiatives for the Digital Hub, which is the coordinating center for APEC's work in mental health in the Asia Pacific. And so it brings together government, public, and private sectors to share, develop, and scale up, and also evaluate innovative, evidence, and service-based programs for mental health. And so the primary objective of the Digital Hub is to provide a novel platform for APEC governments to share best practices, knowledge, and lessons learned in a secure environment that addresses obstacles to early intervention, care and recovery from mental illness, and also supports efforts to strengthen mental health advocacy with national, provincial, and local legislatures. And the Digital Hub is hosted in Canada. So it's hosted through a consortium that includes the University of British Columbia, the University of Alberta, and the Canadian Network for Mood and Anxiety Treatment. So you can see those represented by the red stars on the map on the slide. And the blue dots on the map represent our core partners, which you can see really span the APEC region. So you might recognize some partners in your own countries on the map. The Digital Hub for Mental Health emerged as a recommendation under the Asia-Pacific Economic Cooperation, or APEC's, roadmap to promote mental wellness in a healthy Asia-Pacific. And the roadmap was preceded by a strategic needs assessment that was published in 2016 as part of that roadmap, and which identified key focal areas to guide the work of the Digital Hub. And the focus areas prioritized included those you see on the slide. And the activities of these focus areas are implemented through focus area work groups, I think similarly to the way that the APRU work groups run. And each of these are co-chaired by experts from various APEC countries. And so today I'm going to predominantly discuss the work of the Disaster Resilience and Trauma Work Group, which has really mobilized in the last few months to respond to the mental health and psychosocial effects of COVID-19. And so the Disaster Resilience and Trauma Work Group, along with the Digital Hub executive, met in May 2020. And we were discussing priorities for work in the areas of COVID-19 and mental health, because we know that this is an emerging challenge throughout the region. And we discussed a lot of the priorities and challenges, and there was a lot of discussion about, first of all, the shift in care delivery to digital and virtual models, and also some of the challenges around the most at-risk groups in the region and their access to care. And shortly after we had this conversation, there was a call by the Canadian Institutes of Health Research, which released a rapid response call for proposals for knowledge synthesis studies on mental health and the effects of COVID. And so we saw this as a great opportunity to advance the work of the working group. And so under this program, we were lucky to receive 6 months of funding for an ongoing study that's called Technology and Equitable Access for Mental Health Care in a Post-COVID Asia Pacific, or TEAMCAP, and it needs best practices and opportunities. And so the TEAMCAP study includes partners from 9 APEC economies, including Australia, Canada, Chile, China, Japan, Malaysia, South Korea, the United States, and that includes Dr. Withers, and Vietnam. And so the overall goal of the study is to conduct knowledge synthesis and mobilization to support planning and implementation of digital mental health initiatives with an emphasis on access by high-risk populations in response to the COVID-19 pandemic across the entire APEC region. So we have partners from these 9 countries, but we're interested in gathering evidence from across all 21 APEC countries. And specifically, the study has two objectives. The first is to identify needs and barriers to care for at-risk groups in the context of COVID-19 in the Asia Pacific. And the second is to identify best practices for using digital mental health to provide care to at-risk populations in the context of COVID-19 and also more generally in emergency and disaster-based settings. And so to do this, we are conducting a rapid review, which I'll discuss today, which initially started as a rapid review, but will sort of change into an ongoing living review so that we can keep on top of the rapidly emerging information and evidence in this area. And this review was to identify key mental health considerations for at-risk groups during COVID-19. We're also conducting a 3-stage Delphi consensus process with providers, policymakers, and people with lived experience across the region. And so we'll be looking for participants in that. So if you're particularly interested, please do let us know. Finally, we'll be conducting a scoping review more generally on the use of e-health in emergency contexts. We know that the APEC region has a wealth of knowledge and experience in providing mental health care, including digital mental health care, in the context of emergency and disaster settings preceding the COVID-19 pandemic. So we'll be conducting a scoping review to capture best practices and recommendations for using digital health in these contexts. And so today I'm going to talk mostly about the results of our rapid review because that's sort of been the first outcome of our study. And you can stay tuned and keep up to date with our website to find out more about the other next steps on in this project, which actually goes quite quickly. It's only 6 months, so we'll be hopefully producing things and disseminating them quite quickly. So before I start talking specifically about mental health among at-risk populations in the context of COVID-19, I wanted to talk a little bit about mental health and COVID-19 in the general population. So we know there's several factors that affect mental health and psychosocial wellness in this unprecedented time that we're living in. So social isolation, massive amounts of job loss and economic insecurity, illness and bereavement, the psychosocial and emotional effects of physical distancing, as well as disrupted access to usual health and mental health care have all had a profound psychosocial effect at the population level. And in Canada, Toronto's Centre for Addiction and Mental Health, or CAMH, have partnered with a tech company called Delvinia. And they're conducting regular, I think every 3 weeks, they're doing surveys, population level surveys on the mental health effects of COVID-19 in Canada. And the most recently published data from a survey was collected between May 29th and June 1st. And it had 1,002 respondents over the age of 18 years. And they found that among this population, 21.5% were experiencing moderate to severe anxiety, 24.7% had engaged or were engaging in binge drinking, 23.7% felt lonely, and 21.2% felt depressed. And compared with a previous study a previous survey, from 3 weeks prior, they did find a slight decline in anxiety because here in Canada we have flattened the curve for COVID-19. So I think some of the initial anxiety over the ramifications of the pandemic in Canada have decreased a little bit. But they have found that feelings of depression and loneliness have persisted. The numbers have stayed the same or have gone up. And so this really suggests that there are lasting mental health effects and implications, especially for vulnerable populations. So with COVID-19, we've seen an unprecedented paradigm shift in the rollout of virtual care. And this includes digital, like using smartphones and computers, and also telephone options for mental health care. And even though digital mental health care is evidence-based and has been shown through a lot of studies to be effective in treating both common and severe mental illness, we found that uptake by providers, patients, and throughout health systems was pretty slow prior to the pandemic. But COVID-19 has changed this by really rapidly accelerating the rollout of virtual care, including via telephone, video, and app-based interventions. And though virtual care can improve access in many circumstances, so for example, for people who live in rural or remote areas, or people, or in cases where stigma might impede help seeking from sort of brick and mortar mental health facilities, the digital divide, which refers to the gap between people with easy access to digital technologies and those without, may leave some people behind and some populations behind in the context of this rapid shift to digital and virtual care. And so circling back to the rapid review I described, we want to understand how the pandemic is affecting groups that are at higher risk of mental health and psychosocial effects and may have lower access to care, especially in relation to the shift to virtual care delivery. And so we conducted a rapid review to, first of all, identify priority at-risk groups and their mental health needs in the context of COVID-19 in the Asia-Pacific region. And secondly, to identify recommendations for improving access to virtual mental health support among these groups. We conducted a PubMed and Google Scholar search between June 4th and 12th. And we identified 36 full-text papers that were included in the study. And because of the short time frame between when COVID-19 emerged and the majority, and when we did the search, the majority of included papers at the time of our at the inclusion period for our rapid review were editorials, letters to the editor, commentaries, or brief reports. So I think we had one original research study from China, and then a couple of pieces of gray literature as well. But the evidence is constantly emerging. This is a rapidly changing environment, and I know Dr. Ran is doing really interesting research on the mental health effects of COVID-19 that's come out recently, as recently as today, in fact. So we've decided to conduct a living review that will be updated regularly and posted likely on the Digital Hub website with references and summaries so that we can keep on top of the emerging information in this area. So what I'm talking about today was from the limited rapid review, but this is going to be an ongoing process. So in terms of our findings, in terms of priority at-risk groups for people, for at-risk populations in the Asia-Pacific, and I should say that we included in our review studies that were specific to the Asia-Pacific countries, and also papers that had a global scope and were therefore generalizable. But we excluded studies from places like Europe or outside of the APEC region that were specific to that environment. And so we identified several at-risk groups. For example, people with existing mental illness, and they often have comorbidities, lower socioeconomic status, and precarious housing. And this puts them at higher risk of COVID-19 infection, which then has psychosocial impacts. There's also a higher risk among people residing in inpatient and residential care units. So for example, in South Korea and Japan, we've seen outbreaks of COVID-19 take place in inpatient mental health wards. And so this not only has a physical health effect, but also a psychological effect. During the pandemic, people with existing mental illness also might see a decrease, and have seen a decrease, in their standard, care and psychosocial supports. And this puts them at risk of relapse or of worsening symptoms. And also, as I'm sure many of you, if not all of you know, people with existing mental illness face persistent stigma. And this might also lead to impact in help seeking, as well as access to care. Healthcare workers also face a real psychosocial impact and mental health impact of the pandemic. So they face an increased workload, limited resources, including professional or personal protective equipment or PPE. They're at higher risk of exposure for themselves and their families. And studies emerging from China, including a study by colleagues at Dr. Ran and colleagues, have identified high levels of anxiety, depression, insomnia, and stress among healthcare workers in China. And I think in Dr. Ran's study, the rates are in some cases around 50%, so they're really quite high. So we see a really severe mental health strain on healthcare workers across the region. Black, Indigenous, and people of color, or BIPOC populations, are at higher risk of contracting COVID-19 and also of related negative mental health effects. And the social determinants of racialization, discrimination, and lack of access to affordable, culturally or linguistically appropriate care really exacerbate this mental health risk. So for example, a commentary that was included in the review on the risks facing Indigenous peoples in Mexico indicated that a majority of, especially older Indigenous people living in Mexico, do not actually speak Spanish and lack access to care in their own language. So this acts as a real barrier. Migrants, including refugees, asylum seekers, and migrant workers, also have poor mental health status and lower access compared to the general population. And this precedes the COVID-19 pandemic. So we often see lower health and psychosocial indicators in this population. And they also often lack access to culturally appropriate care for mental health. And during the COVID-19 pandemic, they might face increased discrimination and racism based on misconceptions about, and xenophobia based on misconceptions about the risk of transmission. And they might also face increased stress due to economic and employment insecurity. And last week's webinar, we really saw an intersection of risk between talking about migrant health workers from the Philippines and the mental health risk that this population faces. So there we see the impact both on migrants and on health workers converging. And for older adults, social distancing might further exacerbate the effects of existing social isolation. And we know that in Canada, long-term care facilities have really been at the forefront of the pandemic. We've seen probably the most severe impact of the pandemic in Canada in long-term care facilities for seniors. And this has meant that visits by family, friends, and also volunteer programs that support seniors were cut off. And in many cases, seniors became even more isolated. And this isolation can obviously have a profound psychological impact on older adults. Seniors might also have pre-existing mental illness or cognitive decline that makes understanding and following COVID-19 guidelines confusing and stressful. We also saw a rise in ageist sentiment with the pandemic. So there was a lot of narrative around dismissing the pandemic, especially in the early days, as only affecting older adults, as if this was sort of used to dismiss beliefs about the risk. And the implications of this narrative really may have a negative psychosocial effect on older adults. Finally, the fear of dying alone or complicated bereavement, where older adults are unable to mourn in traditional or appropriate ways, or to mourn with the close support of friends and family, has a negative mental health effect. So one paper that we looked at from the Philippines described the lockdown around COVID-19 limiting or cutting off the ability to go to church or to have funeral services, which is really church is really a fundamental cultural and social support for the population, including seniors in the Philippines. So this has a really severe mental health effect. People experiencing homelessness already experience high rates of mental illness, substance use disorders, and comorbidities. And they often lived in circumstances where measures like regular hand washing and physical distancing are challenging. And this might heighten fear and anxiety about their susceptibility to COVID-19. Also, interruptions in mental health, substance use, and other valuable social services and supports might have detrimental effects on mental health, substance use, and related issues. And so here in Vancouver, where we have an ongoing opioid overdose public health emergency, we've seen more deaths. We actually, a couple of weeks ago, saw more deaths in one day from opioid overdose than we've seen from the COVID-19 pandemic in British Columbia. And so people who use drugs are facing a double public health emergency, which of course has considerable psychosocial impact. For victims of domestic violence, the conditions of lockdown may compound risk. So this includes isolation, economic strain, lack of access to support services, and safe spaces like schools, libraries, or churches. And also we see increased alcohol consumption in the home, which is a risk factor for domestic violence. And this is likely to exacerbate existing mental health issues like anxiety, depression, and PTSD. For people with disabilities, they often face persistent low access to mental health and healthcare and stigma, and they also have an increased prevalence of mental health and physical comorbidities. This makes them more vulnerable to COVID-19 infection, as well as to adverse outcomes from COVID-19 infection, and to the related psychological stress associated with this risk. So gaps in care and support and interruptions in routines can also have a mental health impact on people with disabilities. So for example, for people with intellectual disabilities who might really rely on a regular routine and a regular suite of support services for their well-being, these interruptions can be confusing, they can be distressing, and they can also place an additional burden and strain on caregivers. So we also, in our review, there were quite a few populations that emerged that require further research and attention. And so we're paying attention to these. And these include people living with HIV, LGBTQ+ people, children and youth, women and girls, as well as incarcerated populations. Excuse me. So our review identified a number of gaps and challenges affecting mental health, psychosocial support, and access to care by at-risk groups. So as sort of was a repeated theme as I talked about each individual group, the disruption of standard mental health care, as well as psychosocial and community services can have a real impact on mental health status, as well as access to mental health care for at-risk groups. The poor mental health and psychosocial effects of social isolation and the change in usual routine is also quite a risk factor for at-risk populations, including seniors and people with disabilities, people experiencing homelessness, and other groups that I discussed. Common gaps and challenges also include the lack of linguistically or culturally appropriate and accessible healthcare and information about health, mental health, and COVID-19 risk. And finally, the persistent impact of the social determinants of health, including poverty, discrimination, poor housing, and precarious employment, are put under the spotlight by the COVID-19 pandemic. And their impact on mental and physical health, as well as access to care, are, I think, never more evident than they are during this pandemic. We also see specific challenges emerge in terms of access to virtual care. And these are exacerbated by the digital divide. And this includes the fact that at-risk groups may lack access to telecommunication, like telephones, and to digital technologies, for example, smartphones or devices with video capabilities. Some groups may also live in areas or be in situations with poor infrastructure, lack access to Wi-Fi and to internet in general, for example, as is common in rural communities or among homeless populations. Finally, some populations might experience low digital and technological literacy. So there's been a number of preliminary recommendations that have emerged from this work. And so as I mentioned, the Living Review will continue to update this, as well as our consultations with providers, policymakers, and people with lived experience. But our preliminary recommendations include the real importance of engaging representatives from at-risk groups in planning for service design and delivery. It's very, very important to have people with lived experience at the table so that they can indicate what works in terms of accessibility, acceptability, and to ensure that their voices are heard in planning and dissemination. Also to ensure that information and services, including e-health services, are accessible. And there's several dimensions of accessibility here. And so the accessibility of services in diverse languages is crucial, as we mentioned. So for populations like migrant workers, for indigenous communities, for other types of immigrants or ethnic minorities, to have access to care in their own language is essential. Diverse platforms is also essential. So not just offering a mental health service via an app or via relying on internet access. So to potentially offer options to use a landline telephone, for example. And also to make sure that they're usable for all abilities. And this can include not just including the written text in an intervention, so having possibly an audio recorded option, so people with visual impairment, with cognitive challenges, that can make it more accessible, as well as having access to larger font sizes, so making sure that, that these options are there for people with all abilities. And finally, the need to prioritize research that evaluates the efficacy and implementation of e-health interventions for at-risk groups in the context of COVID-19. So studies that take a population level approach are important, but really taking an approach that identifies specifically the needs of at-risk groups can help to minimize their challenges in accessing these services. And so although the pandemic has brought unprecedented challenges, it really also brings opportunities to build back better, which is a term that's used a lot in sort of post-disaster and trauma discourse around using tragedy as an opportunity to invest in systems that are actually better than they were prior to the tragedy. And so for equitable mental health and psychosocial care and support, there's a real opportunity to build back better. So during the pandemic, there's been actually widespread attention in the media, in research opportunities, and by policymakers in general conversation on social media, et cetera, of the need for enhanced and long-term mental health and psychosocial support to help people cope with the effects of the pandemic. And this has really helped to push mental health further out of the shadows and into mainstream discourse and into the spotlight. And for those of us who have been working in mental health in a global context, we know that this is actually quite rare for mental health to really be at the forefront. And I think that the COVID-19 pandemic, we've really seen this, this discussion happening across the board. Also, the acceleration in the use of evidence-based digital care is also an opportunity if it's done correctly, if it's done thoughtfully and with an emphasis on equity. And this paradigm shift that I spoke of earlier to virtual care is likely to be long-lasting, and it really presents an opportunity to invest in approaches that are inclusive and meet the needs of those most at risk. The pandemic and its social and economic effects have also illuminated the need to address the mental health of social, cultural, and structural determinants of health on mental health and access to mental health care. So there really has to be continued advocacy to ensure that we don't go back to business as usual, to keep these discussions of equity and the social determinants of health at the forefront. So after the acute effects of the pandemic pass, we really need to sort of keep up this push for recognition and acknowledgement and policy that addresses the effects of these determinants of health on mental health and access to care. And so advocacy for health and social policies that reduce inequality are essential. And we're seeing this through the powerful Black Lives Matter movement in the US that has really gained support throughout the world, and including in countries like Canada, and I think probably Australia and New Zealand, also includes attention to the disparities in human rights and access to services and care faced by Indigenous populations worldwide. And so to accomplish this, an equity focus is really needed in research around this topic. Crawford et al. Just in a couple of months ago in 2020, advanced a digital health equity framework to guide more measurement-based approaches to assessing digital health equity. And so research in this area is essential, especially with the shift to digital care that is taking place in the context of this pandemic. And for my next few slides, I'm just going to shift slightly to provide some examples of existing virtual mental health care programs that are currently underway in the region, and in the context of COVID-19 specifically. And the first example is Bounce Back, which is a Canadian example. It's a free supported self-management program run by the British Columbia chapter of the Canadian Mental Health Association. And it combines cognitive behavioral therapy-based workbooks with coaching via a lay provider. So a provider that is trained in the delivery of the intervention, but has no specialist mental health training. And coaching is offered either online or over the phone, and participants can access materials either online or via paper copies. So it goes back to that issue of diverse options in terms of delivery. And during the COVID-19 pandemic, they've actually made it easier to access Bounce Back. And so instead of, as previously required, they would require a face-to-face appointment with a provider and a referral. They're now allowing online referrals and also connecting people who might not have a primary care provider with access to online appointments in order to obtain a referral to the program. And so Bounce Back is available through multiple platforms. It's free of charge, and it has been translated into several languages as well. And I'm going to talk about an example of translation and adaptation of Bounce Back in another context in my next slide. So the Enhanced Measurement-Based Care Effectiveness for Depression Canada-China study, or EMBED study, is led by Dr. Raymond Lam here at the University of British Columbia and Dr. Jun Chen at the Shanghai Mental Health Center. And the objective of the study, which is co-funded by the Canadian Institutes of Health Research and the National Natural Sciences Foundation in China, is to test the implementation and effectiveness of the outcomes of an enhanced measurement-based care approach to depression care. And this refers to the use of digital technologies by both patients and providers to consistently track changes to depression symptoms, in addition to other factors like medication, side effects, and quality of life. And so for the development of the EMBED Enhanced Measurement-Based Care Program, we did extensive formative research where we focused on digital access and acceptability among patients in Shanghai, looking at things like the differences in, from age and gender in terms of accessibility and access. And the program includes using WeChat mini programs to empower patients to track their own outcomes. And it also includes an adaptation of the Bounce Back program that I just talked about. So we've adapted it culturally and linguistically for the Shanghai setting. We've redone all the videos in Mandarin with to be appropriate for the Chinese setting. And we will be training and delivering the intervention in the Shanghai context shortly. And the system also includes reminder systems for follow-up so that people can be reminded regularly to take their outcome measures and to speak with their providers. And I think in the interest of time, I'm just going to skip this slide, but you can definitely go back to look at it when the slides are sent out, or look at our website to look more into the APEC white paper on workplace mental health and safety. And so I'll just end by summarizing a few key points. And the first is that at-risk groups face added mental health and psychosocial vulnerabilities in the context of COVID-19. And we've seen, of course, each group is diverse and has their own challenges, but there are quite a few that, that are consistent across at-risk groups as well. The shift to digital health approaches really has to include equity considerations for planning and dissemination. And this includes engaging people with lived experiences in processes to plan for and disseminate virtual care. And we're doing some work at the University of British Columbia with partners in the Asia Pacific region to kind of address this. Also, efficacy and implementation research on digital mental health options must include a focus on equity in order to ensure access and understand the factors influencing access by these at-risk groups. And finally, the Digital Hub brings together regional expertise, including policymakers, researchers, healthcare providers, people with lived experience, and community members. And it provides a platform to disseminate evidence-based recommendations. And so I've included the Digital Hub website here on the slide and encourage you to check us out and to be in touch if you're interested in learning more or becoming a member of the Digital Hub. It's open to anyone in the region, and feel free to be in touch with me or any of our other members. And so that wraps up my talk. So I really want to thank you for joining us this evening or this morning, as the case may be. And again, thank Dr. Withers and APRU, as well as Dr. Ran for moderating today. And I'm more than happy to answer any questions that you might have.
Hello, everyone. Yeah, that's wonderful. Yeah, so now I want to just welcome all the participants. And then this is the 5th webinar of the series. So I'm so glad Dr. Murphy gave us a wonderful and informative presentation. So this is focused on COVID-19 and mental health. So in Asia Pacific, and focus on challenges and risks and opportunity. So now I noticed many questions. Yeah, so now maybe it's time for us to ask questions. So now the first question I want to say just from the Chen Hing Wing, maybe I guess maybe from Hong Kong. And the question is, maybe COVID-19 would affect the people emotion, and as a result, depression and cause mental problems. This question just maybe Dr. Murphy, would you like to mention briefly? Yeah, of course, yeah.
Sure.
Yeah, COVID-19, yeah.
Sure. So if I'm understanding the question correctly, it's asking whether there is a direct relationship between COVID-19 and increases in mental health problems like depression. And I think it's always difficult to directly refer to causation and correlation, but we are definitely seeing an increase in mental disorders like depression and anxiety in relation to the circumstances surrounding the COVID-19 pandemic. And so these include the psychosocial effects of socially isolating, the lack in consistent care, or the stoppages of regular care, the strain of job loss or job insecurity. So all of these factors, the fear of getting sick, the emotional toll of bereavement or recovering from illness, these are all definitely having a mental health impact at the population level, and we are seeing increases in depression and anxiety. And I should say that research, because the time frame has been so short since the COVID-19 pandemic began, research is really emerging quickly. So we're starting to see more original studies on this. And Dr. Ran, you yourself are producing some of this knowledge. So so feel free to speak to that as well.
Thank you. So another question from the Rolando Ramo Days. And the question is, quarantine and work from home arrangement ran counter to social needs of an individual wanting to interconnect with others. What are your recommended coping mechanism to fill this gap?
Yeah, I think that's a really challenging one, and I actually gave a workshop with a colleague a few weeks ago to a group of BC lawyers who are on mental health, and we talked a lot about that as well. And the slide that I skipped, incidentally, on the workplace white paper that the Digital Hub has produced, we've also included a supplement or a preamble to that to talk about some of the mental health challenges of working in the COVID context, including working from home. So in terms of coping mechanisms, I think it really depends on your circumstances and the extent to which you're locked down. And I know everyone's in different circumstances, but I think kind of connecting with the digital technology theme, I know it's not the same, but using things like WhatsApp or FaceTime or Zoom to connect with friends and family as best you can, and trying to sort of mimic normal social engagement. So if you set up maybe a Zoom dinner party or a WhatsApp dinner party, or you can even watch a movie together over a digital platform, that can help to make things a little bit easier. I think in terms of the working from home and work-life balance specifically, it's important to get regular exercise, to create boundaries between work life and home life as best you can. And sometimes you have to be creative. I live and work in a small space, so I understand the strain of that. But really, I think we're seeing a lot of people having to put boundaries between work activities and home activities. So making sure that you carve out time to do something that is mentally healthy for you is really important. And also, if you find like that you're really struggling working from home, looking up, depending on what region you're in or what jurisdiction you're in, looking online for online social supports and mental health supports to access can also be very helpful if you're really struggling.
Thank you. So another question is from the Joanne Baumgartner. So I hope I pronounced correctly. So the question is a little bit longer. So I love the additional use of digital health, but there is a misunderstanding about what access people have, and is totally dependent on the internet access. which a lot of remote indigenous communities don't have. How can this be rectified?
Yeah, that's an important question and also a really challenging question. And I think I'm hoping that the research that we're doing through this study and other studies that we're hoping to get funded will help to kind of clarify some of those responses in terms of what alternatives there are that can take the place of face-to-face ambulatory care, but also be feasible and accessible in contexts where internet access is poor or unavailable. And I think that kind of goes back to my point at the end about the recommendations of providing diverse options for care. So if you're not able to access the internet, or you're working with a group or a population that isn't able to access the internet, make things available over the phone. As long as there's telephone options. And so even if you're in a community where there might be one telephone or only a couple of telephones that are accessible, to set things up so that care is available over the telephone instead of always relying on the internet. And I think this is a really key point, that the digital divide, the potential of digital technology is massive for the majority of the population, but we also risk further marginalizing a big proportion of the population that doesn't have ready access to either internet connectivity or the devices that are required for these programs. So we really we can't forget about the good old telephone. We have to really still look at offering care via that technology as well.
Okay, thank you. So another question from the Joanto Nabris. And question is, have you found evidence of youth digital care among indigenous people in the Asia Pacific region? And if there will, what were the result or prospect in lieu of the language, cultural, and social challenges?
Sure. Well, that's a really important question, and not one that I can answer with much confidence, because I haven't done specific research into use of digital technology among Indigenous populations in depth. I would imagine that here in Canada, there's been quite a lot of initiatives that include Indigenous populations and the use of digital mental health technologies. And if you wanted to follow up with me via my email, which is on the first slide, I can definitely do some more looking into that. But it's definitely not my area of expertise, but it's something that we're hoping to dig more deeply into through this study. So thanks for the question, and I'm sorry I can't answer it better.
Yeah, thank you. Thank you. So another question just from the Catherine Zhou. Yeah, Catherine Zhou. This is Catherine Zhou from University Hong Kong University, and of Science and Technology. The question is there data showing that the effectiveness of virtual support? We meet a group of students recently who are supposed to be very proactive. However, they became so passive and dependent due to isolation caused by COVID-19 and social unrest. We talked about offering virtual support, but not all the colleagues think that it can help as much as we expect. Do you have any recommendation or advice?
Yeah, that's a great question. So to answer the first part of the question, there is quite a bit of evidence on the efficacy of digital mental health interventions. So a lot of the research shows that digital options are as effective as face-to-face interventions for treating, for example, both common mental illness like anxiety and depression, and also more severe mental illnesses. In terms of evidence about the efficacy of digital health during the COVID-19 pandemic, we haven't really seen results on those studies yet because the time frame has been so short, but it's definitely a high priority area of research. So I would keep an eye out for research that's emerging. One journal that's very good to look at for that is the Journal of Internet Medical JIMR, Journal of Internet Medical Research, and they have a mental health specific journal. And they are kind of at the forefront of publishing studies on that. But I think that the general sense is that for students, especially because they have quite a high, they use smartphones very, very regularly, and that digital mental health interventions are quite acceptable to them. And we know from pre-COVID days that these approaches are effective. And so I would definitely recommend looking at that route for the students that are having challenges related to isolation. And I think they can be effective for sure. Yeah.
Thank you. Thank you. So now I go to another question just from the Benelin Damilo. The question is, mental health care provider, as you mentioned, are now overwhelmed due to increased number of cases. Are there programs for training teachers or mental health care providers to reach out to students needing help?
Can I clarify what is that in terms of?
Are there any program just you know or you are doing for training teachers to reach out to students? Maybe the student need help.
Yeah, that's an interesting question, and I don't actually know of any specific programs that train teachers in this context. But there is quite a lot of there are quite a lot of mental health programs from the pre-COVID era that involve teachers in providing mental health support to their students in schools. So I don't see why this couldn't happen sort of in a virtual format, and it very well might be happening. So I know of some studies. I know of a study that was done in the Philippines actually a few years ago with that involved teachers in building up sort of mental health support in the schools. So I think that this, if it's not already happening, it's something that would have a lot of potential. And I wasn't sure whether that question was referring to students in general or to medical students, but I think either way, I mean, obviously, yeah, I think either way this could be quite effective.
Okay, another question, just a brief question, but it's a little bit hard. From the Rick, Charlie, Jordan, Kayat. The question is, what do you think will be the trend of mental health post-pandemic?
Would be the trend of mental health post-pandemic?
Yeah, that's right. Trend of mental health program or care or something, or mental health problem, maybe, I think.
Well, I think we are going to see a long-lasting mental health effect resulting from the COVID-19 pandemic. I think it's also really important to acknowledge the intersection again between the social and economic determinants of health and mental health. And so that will really be entwined with how we come out of this pandemic as a society in terms of mental health. In terms of the trend towards mental health care post-pandemic, I think also, like I said, we're seeing a paradigm shift where the use of digital and virtual care was actually kind of chugging along quite slowly. There was a lot of resistance to adopting, and COVID-19 has sort of forced and pushed us in the direction of adopting those technologies and those approaches. And I think that's kind of here to stay. We'll go back obviously a little bit to the way it was before with face-to-face care, but we're also seeing the potential of digital care and breaking down some of the preconceptions about using it. So I think we need to make sure that, kind of similarly to my question about the mental health impact of COVID-19, we really have to make sure that any shift that happens in how we deliver care really takes into account equity and access by the most at-risk populations.
Okay, thank you. So because there's still some question, but I think maybe given the time, maybe I ask you a question briefly. Just you mentioned about, I think just digital mental health care is very important. However, sometimes some researchers, some of us considering another issue we should pay attention. So for example, internet addiction or dependence. Mm-hmm. Yeah. So how do you think about this?
Yeah, I think that's an interesting one, and one that actually came up. I was doing some reading earlier on the acceptability of digital care, mental health care among youth in Vietnam, because I do a lot of work in Vietnam. And one of the concerns that parents had was was internet addiction. And to be honest, I know it's not something that I know a lot about, but I know that it is a concern in countries like Vietnam. And so I think, I mean, it's a tough question to ask, not being an expert in the area, but I think that like anything, there's healthy use and then there's problematic use. And so really ensuring that we support youth and people that are using internet-based technologies or platforms to engage in healthy use of the internet and moderate their use of the internet. That, you know, it's sort of about harm reduction and healthy use rather than that it doesn't have to be an all or nothing game.
Okay, thank you. Give me the time. So now I want to thank to Dr. Jill Murphy again from the University of British Columbia. And the recording and the slides will be shared via the email and on the website aprUplus.org. And the next webinar will be at the same time next week, given by Professor Walter Smith from the University of California, Davis, to talk about One Health and COVID-19. The Dr. Melissa Weiser will be the moderator next week. So thank you again and see you soon. Thank you.